you're stuck at home. Well, it is a strange and unusual time that we now live in, but look at the bright side. Maybe we can use that time to do things that you have always wanted to do. After all, even in our clinic, when our couples come in, and one of the first things they tell us is that, oh, maybe we haven't been trying hard enough, maybe we haven't been active enough. And when we ask them why, the standard answer is busy, work, traffic jam, floods, mother-in-law. No, just kidding. But time is always an issue. So perhaps now that you have more than enough time, you could use it effectively to help get pregnant. We are expecting a baby boom in 9 months from now, and if you're wondering why, it's very simple. Couples are stuck at home and there is just so much of Netflix that you can watch. What else is there to do but try? On our part, we think that it's a good idea to assist you by informing you and giving you some information, some knowledge that may be of use to you. On my part, I thought that I would start by talking about the important menstrual cycle. You'll be amazed that more people know how the KL share market works compared to people who know how the menstrual cycle works. There are two important myths regarding the menstrual cycle. Number one, many people believe that the menstrual bleed is the egg coming out. This is not true, and I will explain why. The second myth is that they believe that as long as you have your menstrual cycle, you are ovulating. That is also not necessarily true, and I will explain why. To help me explain the menstrual cycle, I will use my favorite 3D model of the womb. Yes, this is the normal size of the womb. Just ignore all these little bits, fibroids and polyps and such, and assume that it's a nice clean uterus. These are the tubes and the two ovaries here. Now, what happens in the normal menstrual cycle is that there are eggs in both the ovaries, and at the beginning of the menstrual cycle, a number of these eggs are recruited. After a few days, one egg is selected. That egg, or rather that follicle, will grow and reach a dominant size, and at which time the egg is released. That is called ovulation. So there is recruitment, there is selection, there is dominance, and there is ovulation. Now, as the follicle grows, it releases estrogen, and estrogen causes the lining of the womb to become thick. Now, after the egg is released, the egg shell is now called, or the empty follicle is now called a corpus luteum, and the corpus luteum will now release progesterone. So what you then have is that the estrogen initially causes the lining of the womb to become thick, and then you have the progesterone from the corpus luteum that causes the lining to become stable, and exactly 14 days after the egg is released, if there is no embryo, the corpus luteum will crumple and the progesterone levels will fall and the menses will follow. So there is a very intricate 14-day mechanism which is called autolysis, and that is what gives women a normal, regular menstrual cycle. So just because you get your menses, it does not mean that you're ovulating. It has to be regular menstrual cycles, and normal cycle duration can be anything between 21 days to 35 days. Not everybody has a regular 28-day textbook cycle, and as long as your cycle is regular, you are likely ovulating. If your cycles are not regular, then it is most likely you are not ovulating. And the definition of regularity is a menses that comes within plus minus 2 days of the expected date. That is the definition of regularity. And I hope that by understanding your menstrual cycle, you will be better able to plan when to try. When should you try? That is a topic for another day. How to try? There are many ways out there that you can learn that. Okay, I don't want to get arrested. Good luck and stay safe.